think in order to provide care to underserved populations, I think the number one thing is being accessible. And I think that pharmacists are in every community, in many different types of settings, particularly community pharmacy. There's literally a pharmacy on every corner, and so they are accessible to patients. And I think that there are some counties in many states in the United States where pharmacists may be one of the only healthcare providers available. So what I would say to a pharmacist about provider status is I would say look beyond the buzzword provider status and understand what it means and understand how it affects them. There are a lot of professionals that may say, well, I'm not really looking to provide expanded services, or I already do that, so it really doesn't affect me. But it does, because it affects all patients, because patients don't have access to pharmacy care services unilaterally. And so therefore it does affect them, and they need to be engaged. They need to understand what gaining provider status means for these Medicare beneficiaries. They need to understand what it means for other patients for whom access will be expanded as well, because their insurance companies will now recognize that pharmacists are healthcare professionals that can provide a greater level of service. They need to be engaged with patients and educating them and helping them to see that pharmacists are integral members of the healthcare team that can help them to achieve the goals that they have set for themselves in terms of getting the most out of their medications.